This is just a short presentation to give you an overview of some look-alike, sound-alike medical terms.
Clear, concise communication is important in healthcare. Terminology is very tricky and becomes even more complicated when terms are pronounced the same or look the same and can become easily confused. Healthcare workers need to be diligent and precise in their spelling and pronunciation in order to avoid errors. Homonyms are words that are pronounced the same but have different meanings. They may or may not be spelled the same, and we have a lot of them in healthcare. If you are reading a medical report or similar type of document and you come across a term that is unfamiliar to you, you can sometimes ascertain the meaning of the word from the sentence or paragraph it is in. For example, if you read the sentence, "Jimmy forgot to take his bat to baseball practice," you have a pretty good idea that Jimmy forgot to take his club used to hit the ball in the sport of baseball rather than a small flying mammal. Often the same principle can be applied to medical terms. Pay careful attention to spelling, as often one letter can be the difference between the meaning of words, and use resources like medical dictionaries, both print and online, if you get stuck and need help. This presentation is going to give you a list of some of the more common look-alike, sound-alike terms in healthcare. This is by no means an exhaustive list, but it will bring some terms to your attention and give you some to review. First up is the term ilium. Spelled I-L-I-U-M, it refers to a bone in the pelvis. Spelled I-L-E-U-M, it refers to a portion of the small intestine. Two very different structures, but spelled almost exactly the same. In the urinary system, the terms ureter and urethra are often confused. Although they are not spelled the same, their pronunciation is so similar that they are often confused. And the structures themselves are so close anatomically that it is sometimes hard to remember which is which. I tell my students to remember there are two E's in ureter, and there are two ureters in the body, one from each kidney, and only one E in urethra, and only one urethra from the bladder to the outside. So I hope that helps you remember too. In the musculoskeletal system, trapezius and trapezium are very similar sounding terms. Trapezius is a large muscle in the back and shoulders, and the trapezium is a small bone in the wrist. The terms malleus and malleolus are also very similar sounding, and both refer to bones in the body. Malleus refers to one of the tiny ossicles in the middle ear, and malleolus refers to the distal ends of the tibia and fibula that make up part of the ankle joint. For the terms neurology and urology, the spelling is usually not so much an issue as is the pronunciation. When speaking, the terms sound very similar, so be careful when saying the terms and when listening to the terms. For example, did that elderly, confused patient need a urology consult for a possible urinary tract infection, which can lead to confusion in older patients, or did they need a neurology consult to rule out a possible stroke? If you've taken any basic anatomy class, then you're probably familiar with the terms abduction and adduction. Abduction, sometimes pronounced abduction for the sake of clarity, means to move away from the midline of the body, like lifting your arms away from your sides. Adduction, or adduction, is the opposite motion, or moving towards the midline of the body. An easy way to remember is AB, away from body, and ADD, add to body. Hemostasis refers to the stopping the flow of blood, while homeostasis refers to maintaining a state of internal balance, like a normal body temperature or blood pressure. And while hemostasis will stop excessive blood loss and keep blood volumes normal, therefore resulting in homeostasis, the two terms have very different meanings. Metathesis and metastasis are tricky to pronounce, so that's why they're included in this list. The metathesis is part of a long bone, and metastasis refers to the spreading of cancer cells from one area of the body to another. The term prostate is frequently mispronounced as prostrate with an extra R added. Prostrate is a position, as in lying prostrate, or lying face down on the ground, as in humility, submission, or adoration, and it often has a religious connotation. The prostate is an organ of the male reproductive system. Dysphagia and dysphasia. These two terms are especially tricky because they are pronounced exactly the same and their spelling is almost identical. To make matters worse, they are conditions that may be found in the same patient if the patient suffers from something like a stroke that impairs both their ability to speak and swallow. Dysphagia with a G refers to difficulty swallowing, while dysphagia with an S refers to difficulty speaking. I remember dysphagia with an S for speaking, and that helps me differentiate the two. There are many more examples of look-alike, sound-alike terms than what are listed here. These are just a few examples. In healthcare, you need to be precise in communication to avoid potentially deadly errors. Look for context clues in written documents if you're unsure about the meaning of a word. If that doesn't help, ask the person who wrote the report to clarify, or if they are speaking, ask them to repeat what they said. If that's not possible, consult a resource like a medical dictionary or your medical terminology text. There is a ton of sound-alike terms on the Metathesis website. The website address is listed on the slide. Thanks for watching.